All right, welcome everyone. Thank you for joining the Samsung-sponsored lunch symposium. We have a speaker that will start the session, and then we also have some live scanning that will be performed by Dr. Sinkovskaya. And so I'd like to give a short introduction. We have Mishella Perez, who is the clinical ultrasound educator with Scripps Health Division of Maternal Fetal Medicine in San Diego. She specializes in high-risk OB, fetal echo, and she brings 2 decades of experience in an actively involved national ultrasound education and professional organizations. And she's going to be speaking about essentially how to run an efficient maternal fetal medicine lab based on last year's published recommendations from SMFM. So everyone, please welcome Mishella Perez.
All right. So good afternoon, everyone. And thank you so much for joining us today for this luncheon. I'm truly honored to be here at the Society for Maternal Fetal Medicine, and especially grateful for Samsung for sponsoring this luncheon and inviting me to speak on how we can build an optimal high-functioning maternal fetal medicine unit. As many of you know, the SMFM convened a national expert workshop on what defines an optimal maternal fetal medicine ultrasound unit, looking at workflow, quality, training, emerging technologies, and the evolving role of sonographers, specifically MFM. I don't know why my slides are kind of going on their own, but I had the privilege of participating in this workshop, and today I'd like to share at least 5 key pillars that emerge from those discussions. And these elements truly move the needle for efficiency, quality, and team support. So these are the key pillars. So starting first with infrastructure, workflow, and ergonomics. So one of the strongest messages from the SMFM workshop was this, is that the physical environment of the ultrasound unit is not a luxury detail. It is patient safety and staff safety issue. Everything from the room layout, I don't know why it's playing, to supply placement, to ergonomics, directly impacts efficiency and quality. And so what exactly does an ideal environment look like? First, the physical design of the ultrasound unit itself. High-performing units intentionally involve ultrasound personnel in the planning because the people doing the work understand the workflow best. Room size matters. It has been recommended that a minimum of around 150 square feet to allow for safe positioning, ergonomic movement, and flexibility during complex exams. But it's not just about the space. It's about how that space is used. The positioning of the equipment, patient bed, and machine should be minimized of reach and unnecessary movement. And perhaps most importantly, room standardization in which rooms are set up in the same way. Second, smart and thoughtful scheduling. So units may use a master schedule model where the team absorbs the workflow collectively, and you could see those examples here that provided from the workshop, or a sonographer-specific schedule which supports continuity and preparation. But whichever approach is used should account for the type of the complexity of the scan, the sonographer's expertise, and the need for protected breaks. So I'll repeat that again, the need for protected breaks. New patients and detailed anatomy scans are best placed early in the day, while follow-ups and growth scans can anchor later time blocks to help absorb delays. Standardized protocol-based durations make workflow more predictable and give sonographers the realistic time to perform high-quality exams. And I actually included here the FAIUM practice principles, which we did publish back in 2020, providing the recommended scan times. And just to keep in mind, this does not include the room turnover and as well as the reporting. And finally, of course, having a lead or float sonographer who can definitely step in when complexity increases or if there's unexpected findings, especially when you have a high BMI patient or especially when you have multiples that are staggered like right one after the other. Lastly, ergonomic safety. So who knows a sonographer who is currently scanning in pain or due to an injury? Just curious. Wow, that's like a lot of you guys here. So protecting the workforce is certainly not optional, it is essential. This includes adjustable beds, shorter reach distances, arm supports, built-in micro breaks, and providing the ergonomic education that we need. As we know from national data that up to 90% of sonographers experience work-related musculoskeletal disorders, which cost employers about $120 billion a year. Now, these injuries are career-ending for many and preventable for most. So this is where technology plays a direct role. So here we have Samsung's Z20, which was designed with sonographers in mind, lighter cables, improved range of motion, and a console designed to reduce shoulder abduction. These features support exactly what the SMFM emphasized, keeping sonographers healthy so they can continue providing high-quality care. And also the next step is optimizing workflow. One small change that makes a big difference is consistent image ordering. Instead of manually reorganizing images after acquisition, software intelligence, just like Sonyo, working alongside the Samsung platform, automatically organizes images based on annotations. So now we're moving on to quality assurance and standardization, which is another pillar that I'm identifying here. So the SMFM consensus was clear. Structured audits are essential to maintaining high imaging standards, but as a specialty, we haven't defined the ideal frequency or format. Many units perform best care audits for accreditation, but these don't represent the real world interpretation. What we need is routine, objective, standardized review of images, randomly selected, scored by trained reviewers with pathways for remediation if needed. Now, standardized imaging protocols are the foundation of quality assurance. As you can see here, the AIUM practice parameters and the ISWAG guidelines define the required views, the measurements, and documentation needed for comprehensive fetal evaluation. As highlighted in the SMFM special statement paper, standardization reduces variability between operators, improves diagnostic reliability, and creates a constant framework for training, quality review, and workflow efficiency. So once standardized imaging protocols are defined through guidelines such as AIUM and ISWAG, which all of us do use, the next question becomes, how do we ensure that they are consistently applied in daily practice? So this is where you have objective audits become essential. And the SMFM recommendations emphasize structured quality imaging review, including random case audits and defined evaluation criteria to assess adherence to protocols and support continuous improvement. And this is just an example that we use at my lab at Scripps, where we have what we call the MFM sonographer transition program, and we also have preceptors. This is the criteria, just looking at an image, of what defines as a good quality imaging, especially for abdominal circumference. So that's just an example. The SMFM workshop emphasized that quality assurance doesn't stop with protocols or audits. It requires tracking outcomes. Now, measuring detection rates, false positives and negatives, and incomplete studies helps teams move from process evaluation to understanding the true clinical impact. So here is an example template case review of a quality assurance audit that actually obtained from the document itself, which may be helpful for those of you who are trying to develop this quality assurance program. Now, how do we actually operationalize these principles in daily practice? So tools like Samsung's EasyCheck provides real-time workflow guidance during the scan. So you have to think of it as an ultrasound wingman, or what I say, wingwoman, tracking ISWAG-based checklist progress, flagging missed views, and helping maintain a structured exam. So when combined with AI assist tools like View Assist and Biometry Assist, it reduces cognitive load, improves efficiency, and supports more consistent, high-quality imaging. While EasyCheck helps ensure exam completeness, here we have Quality Check focuses on validating image quality itself. Quality Check uses AI-based criteria to assess whether acquired views meet clinical standards, supporting consistency of both live view assist guided and manually acquired images. Now, the next step is continuous quality assurance. So how can we actually embed that? So here we have Sonyo's quality checker. It takes us further by analyzing exams at multiple levels: individual exam quality, sonographer performance trends, and overall practice improvement. So instead of reactive auditing, this creates a proactive feedback loop, identifying missing views, tracking quality metrics, which I think is very important for those of you who perform a comprehensive QA in your lab, and helping teams continuously refine imaging performance. Now, the third pillar, and one that's very close to my heart, is actually the training, competency, and the sonographer career ladder. So the SMFM workshop highlights significant national variability in how MFM fellows and sonographers are trained and assessed. Some fellows only receive a few months of ultrasound exposure, as many of you are probably fellows here too, while others undergo structured programs. And for sonographers, that gap is even wider, specifically MFM sonographers, with many transitioning into MFM without sufficient advanced training. Structured onboarding is essential. SMFM recommends multiple proctored studies before independent scanning, typically at least 5 supervised observations per exam type to build consistency and safety. But onboarding alone isn't enough. We also need defined competency metrics, objective measures of image quality, protocol adherence, and progression. So training becomes measurable, reproducible, and scalable across all practices. And as for sonographers, as I mentioned, the gap is often even wider. Many OBGYN sonographers and even those transitioning from general radiology enter MFM without sufficient exposure or training to complex pathology, detailed structured assessment, even advanced imaging, advanced Doppler, or even fetal echo. And here you could see is just like an extensive list that we actually produced from this workshop of what is considered as a perinatology sonographer competency domains. So the SMFM workshop emphasizes that developing an MFM level sonographer typically requires about 6 to 12 months of structured training. And this is certainly depending on that baseline experience. So this highlights an important point. MFM sonography is not simply an extension of general OB imaging. It represents a specialized skill set with defined competencies, structured career pathways, and the need for formal recognition. So that's why we have organizations such as, including SMFM, AIUM, SDMS, and the RDMS are now collaborating on a national certification, and that's something I'm proud to say I'm part of. And this is exactly where the conversation evolves. Not just training sonographers into MFM, but creating a clear pathway for continued growth. Now, if MFM sonography represents a specialty skill set, then there also needs to be an advanced clinical pathway within that specialty. So this is where the role of the advanced practice sonographer, or APS, comes in. So how many of you have actually heard of an advanced practice sonographer or actually employ an advanced sonographer at your lab? I see. So there's a few. So the APS role builds on foundational OBGYN and MFM expertise to support workflow efficiency, expand patient access, and function as a physician extender within the ultrasound unit. It creates an elevated career ladder from OBGYN to MFM to advanced practice, helping retain highly skilled sonographers while strengthening clinical care delivery. So this is something that we are currently working on the back end to push through. Now moving on to the fourth pillar, which is communication, an area that directly impacts patient experience and trust. So the SMFM workshop reminds us that communication quality directly impacts patient trust, satisfaction, and clinical outcomes. High-performing units don't leave communication to chance, they standardize expectations. So when what patients are told, who delivers the results, and when those results are communicated, ideally within 24 hours. And just as important, clear workflows strengthen team coordination, especially when integrating genetic counselors early when anomalies are suspected. Building a communication workflow, such as teleultrasound, is becoming an essential extension of modern MFM practice, but only when it is structured. The SMFM workshop emphasizes that communication pathways between the sonographer, interpreting physician, referring provider, and the patient must be clearly defined and standardized. The teleultrasound isn't just remote scanning, it requires intentional workflows. That includes using video clips to document anatomy, ensuring patients understand when studies are interpreted remotely, and when results will be delivered, maintaining predictable timelines. So that is certainly critical with teleultrasound. So this is where platforms like Samsung SonoSync come in. SonoSync allows real-time image streaming, so interpreting physicians can see exactly what the sonographer sees. Integrated voice communication for immediate guidance, and even remote system control when needed. Instead of asynchronous communication and delays, this creates a collaborative scanning environment, improving accuracy, education, and patient care, especially across remote or multi-site practices. Sono Tele MFM, and this is by Sonio, streamlines the referral process by allowing seamless sharing of images, structured reports, and clinical information between referring providers, specialists, and MFM teams. So everything we've discussed, workforce development, structured workflows, communication, and teleultrasound, ultimately generates something incredibly powerful, and that is data, right? And the future of high-performance MFM ultrasound units will not just depend on imaging, it would also depend on how we use data, analytics, and AI to continuously improve quality, efficiency, and outcomes. So here is an example of Sonio Analytics, which allows us to see performance trends, identify training gaps, and understand staffing needs in ways we've never been able to do before. So as we move into AI, one thing is important to say clearly: AI is not here to replace clinicians or sonographers, and I'll be very honest about that. AI is support, so really try to embed that in everyone's brain today. Automation helps reduce variability and cognitive load, and improving consistency and decreasing error. Analytics, as you saw, allows us to see performance trends, and in other words, AI doesn't replace expertise, it amplifies it, allowing teams to focus more on the clinical decision-making and patient care. So as you move into the live demonstrations by Dr. Elena Sinkovskaya, I invite you to look at these technologies. So we have Samsung's Hera platform, Sonio's real-time quality checks, Easy Check, Live View Assist, and SonoSync as not as gadgets, but as tools that will clearly support and optimizing prenatal care in the near future. I want to say thank you to each and every one of you for all that you do, as most of you guys are here physicians, and really look forward to what we could do as a group collaborative to improve patient care. And thank you, Samsung.
Good afternoon, everyone. Thank you very much for joining us for the Lunch Symposium by Samsung. And thank you very much to Mishella for that comprehensive introduction and very detailed presentation that highlights such a difficult task is to run the efficient MFM practice that delivers the superb and the best care for our patients. But we are lucky enough to live in the digital era, and we are all supported and surrounded by the technology and devices. And today is my pleasure and privilege to introduce to you not just the technology available on the latest ultrasound equipment, but somehow the whole ecosystem, full of the solutions that's presented by Samsung for the MFM practices that can help you to run the very efficient, productive, and safe MFM practice to deliver the best care to our patients. And today we have a very ambitious plan in the next 20 minutes, and I would like to thank the Samsung representatives to help me to have this simulation, how all those technologies can be put together, and we will start this demo today, so that we will show you how we can start from the scanning the patients and how we can implement all the additional devices and technologies. Some of them can be a little bit overlapping and redundant, and I think this is the great thing because it can help you to identify the technologies that fit best for your institution, for your settings of practice, and you can combine them and you're not stuck to just one thing, so that you have a variety that can help you to achieve the best level of customization. And with that, we're going to start, and it's my pleasure to introduce to you the latest and greatest ultrasound system by Samsung. This is Z20. And we will start looking at the presets, and I would like to highlight that all of us surrounded by devices, each of us have like several personal devices, and it's no wonder that the Samsung wants to have the same experience with the ultrasound system that you have with your personal iPhone, their personal cell phone, for example. So, and to demonstrate that, I would like to show you that here we have the latest level of customization. So this is a touch screen. I like my presets. I want to make sure that I find the buttons that I get used to at any place I go, and those presets can follow me anywhere around the globe. And this is something that I can just easily log into my account and have all my presets there. And here I'm just pushing on my name and I will sign in, and all the presets that I like, all the tuning of the buttons that are required for my everyday practice, so they are right here. So also would like to show you, you probably notice on the top of the screen that the system gives you a very good advices on how to follow the best practices for ergonomics and minimize the injury when you're in the working place. So it already feels very personal that the system really is your friend, and this is very smart friend that cares about you. And this is about the AI in general. So it's very compassionate, and unfortunately, I think as the human beings, we are missing that component lately a lot, so that the AI and the ultrasound system can be your friend if you use that correctly. So that all that said, so we have the patient and we will start the patient. And here I want to make sure that no matter what happens, I'm pretty confident, I'm in the practice for a long time, but I want to make sure that if I need help, I can utilize that right away, and it's going to be at my fingertip. So I will activate my helper. This is the easy check that helped me to make sure that I follow the protocols that, and I deliver the ultrasound of the highest quality, and that it's compliant with the guidelines, and that it's inconsistency with that document that we just reviewed with Mishella. So we are doing, we're gonna put the patients, and again, like in the practice, you can arrange it a little bit differently. So, but we are doing that very sophisticated simulation here, and we just started this exam. So as it was emphasized that utilizing the presets and streamlining the workflow, it's a critical thing to achieve very accurate exam, and not to spend time on things that you don't really want to spend time on. So here I would like to show you that we will start from the picking the high frequency ultrasound probe, and I will be honest with you, my favorite is 3 to 10 megahertz. So this is the highest frequency. We should always start from the highest frequency, and that provides a very good visualization on all sorts of the patients. So then we have the big menu, and you can see it here from the presets, and our patient is in the third trimester, so we will activate that. So now we are ready, and to start from the general assessment, I want to evaluate the position of the fetus. So we in the third trimester, about 34 weeks gestation, and first we are checking the presentation, and here we can see that the baby's head is down. So and at this point, I turned off all the post-processing tools, and I just want to demonstrate to you so that we can see pretty clearly here what structures of the brain is demonstrated on that axial plane, but also we have the system of the quick presets that are specific for the certain anatomical region. So this is a new approach to the presets, so we are not turning the presets based on the gestational age as we get used to, but also to the specific anatomical area. And for that, we have the sub-presets, easy structure. And now I'm gonna optimize the image by the push of one button, and we are now at the preset of the fetal brain. And I hope that you can see the difference, how immediately well we can recognize the different structures, keeping in mind that it's quite challenging to visualize such as structures as the thalami and the cavum, septum pellucidum at that gestational age. And yes, you can actually turn it off and try to put all those presets manually. If you're that type of person, you can do that and achieve pretty much the same result. But if you are in rush and not really want to spend that time and it's just not your thing, you can utilize the brain preset and you will achieve the same result. And it's okay if you're lazy and don't want to push multiple buttons, because we're all different, and some people like the easy ways and others prefer to have challenging path in life. So that here we have the head, and also what I would like to show that in MFM we are doing not just evaluation using the 2D imaging, which is, you can see it's the superb quality here. So, but also the very important part is the evaluation using different color Doppler techniques. I'm not going to show all the variety of the Doppler modalities that are available on the system. I would encourage you to visit the booth and experience that on your own and see the specific examples. But here I just want to show you that how the image optimization of the Doppler can be performed. So if we will just go to the regular preset, we would put color on, and then we can see the chord pretty nicely. We will activate the spectral Doppler, and we will just obtain the plane here. Very good. Let's get out of the brain. So that we will activate the Doppler and we will get the assessment of the umbilical artery. And it looks pretty good. So we can see very nice spectrum. But if you want to do the image optimization, you have the ability to adjust that, the push of one button, that you're using the easy flow preset. And I'm going to do, oops, the baby moved on me, of course. So that we need some collaboration of the little ones as well. So not always happens. So that here I just want to show you this is where we were, and the adjustment using the easy flow. You can see that the sweep speed got changed and the scale was adjusted automatically, and that happened with the push of one single button. So that really streamlines the process, and if the fetus is very mobile, so that actually helps you to catch what you need very quickly. So as soon as we were on the head, I also want to show you that if we are looking at the brain preset and we are scanning in 2D, once we activate color Doppler and we want to measure, for example, the MCA, it automatically will go to the easy flow preset related to MCA. So once the system knows, and the system is very smart, that you are investigating the brain structures in 2D, and then you're at the same plane and you want to do Doppler of the MCA, it will switch automatically to the easy flow that is presetted for the assessment of the MCA, and see that that flow is optimized right away. So you're not really spending any time on the image optimization. It's already optimized for you. And traditionally, this is a very challenging type of manipulation, especially if you're not very familiar with the OB exams and you're very overwhelmed with the movement of the fetus, you struggle with the shadows, and the mom is really having difficult times laying on the back and breathing a lot. So this is really eases your everyday practice. So, and as you can see here, you can, I think, see the precision of the automatic measurement of the curve that we got, and you can select several cycles, like, limiting the trace to 2 or 3 cycles, or you can include the whole thing. And I think that also eases the process of getting the Doppler parameters. So that all that said, so that highlights how easy the image optimization can be performed. And again, there are options to do that manually, or you can just go with that optimization of the workflow. So now let's talk a little bit about the protocol that is supposed to serve the aim of the highest quality of the examination, and that will help us not to miss any structures during the exam, and help us also to ensure that every picture that we are taking and saving in the PAC system, that is the highest quality and we don't miss anything. So for that, we will get to the anatomical region, let's say the fetal abdomen, and we don't have enough time to get the whole detailed exam. We need an hour for that based on the guidelines that the Mishella presented earlier. But I would like just to show you how potentially it can work for you in your clinical practice. So, and for the sake of the time, the feed is showing me the back, so pretty much ignoring me a little bit, but it's still going to be enough for us to demonstrate what the system can do. So I will activate the assistant or the helping tool. So that is the Live View Assist. So that looks at the anatomical region and tries to recognize the structures that's supposed to be included in our exam. And now we're examining the baby's spine, and we are looking from the cervical region to the sacral region. And then we can pause that, and we can really go to the other structures. For example, we can see that here in this position, the best, we can evaluate the baby's kidneys, which are here. We can restart the Live View Assist, and you can see that that also captures the picture without me pushing any buttons, but concentrating just on looking at that. So, and again, you can have it on all the time, or you can turn it on and off, depends on your habits, and again, your experience and what you would expect this tool to help you with. So this is something that you can always control at any time of the exam. So for example, here I have the femur length. I am lazy. I don't really want to take any measurements. I want the system to take it for me. And here we have several of those measurements, and we can take a look at the abdomen. So hopefully we will get a very nice image of that, so that meets all the criteria, but we will see if the system will agree with my clinical judgment. So, and we'll take that view. So then we can go to the upper extremities, we'll take a look at the humerus, and finally we will go to the brain again, and the goal for the system to pick up the measurements of the head and the assessment of the posterior fossa and other structures that we need to document at any time that we see the patients. So we will try to get some face images as well, so we can see the port right in front of the face. But here clearly we can recognize the lips and nose, and what's really important that the system can do the same. And if you're following me here, so you can see that I'm not pushing any buttons, but the system is actually recognizing the views and taking those views and saves them on the hard drive of the system, so that the gallery of the images that needed to complete the exam is already building with all the labeling of the view and the necessary measurements. So, and as soon as we go, so I think that now we're gonna switch the preset and go to the heart. That's my favorite part, so that we can really try to get also the cardiac planes. And I think at that point we will probably not complete the whole examination, but we will have something to review and get the sense what the system can do for us and how it can help us. So here we are scanning at the level of the 4-chamber view. This is the critical plane that absolutely have to be obtained. So we are looking at the LVOT, we are looking at the free vascular trachea view, and so now we will try to turn the probe and get the arch view. This is the beautiful aortic arch view. Hopefully my AI assistant will agree with that too. And this is what we can see. But let's imagine that I am a very novice operator and I'm not sure if I'm doing the right thing. And sometimes then you scan, you need the second opinion or you need some help. And very often you may operate in the outreach settings, or you can find yourself that you are the physician who is reading the images from the very remote areas where only the not very experienced sonographer may be present. And for that, we have a very amazing solution to the Samsung that's called the SonaSync that I hope we will be able to demonstrate here. So, and that would be some connection. But before the connection is going, I also want to, there we go. Here on the screen, you can see that the help is on the way. And that, have you accepted? Yes. Alrighty. So that then the Dr. McGee is going to step in and help me with certain structures. Let's say if I'm struggling to get the abdominal circumference, or if I'm struggling to get the appropriate settings for the color in order to visualize, for example, the 3 vascular trachea view. So I can show you that I'm not gonna do anything with my hands, and magically Dr. McGee will be able to turn the color on. See, like I'm not doing anything with my hands. So it may happen from the table next to me, but it also may happen from the any remote area. I mean, let's say I am in Norfolk and he is in Texas, and see he can turn on color, can change the type of the color used, can activate the spectral Doppler, and basically verbally can guide me what I need to do. For example, here I may adjust the baseline or something like that, so that all of this can be done remotely, so that the experienced sonographer or experienced physician can take over the controls over my ultrasound system, and basically I will be functioning as the robotic arm that gets the picture, and all the other controls will be done remotely, or I will be giving instructions what to do to improve the image and to obtain the sufficient quality images, and so that we will work as a team. So that I would like to also demonstrate that there is a built-in tool that helps us to make sure that all the images that we obtained independently or the help of the remote advisor, so they are meeting the criteria. And here I would like to introduce go to chart. Okay, all right. So I'm not going to introduce, I'm not allowed yet, so that it's going to be the conversation, so that I have to obey the orders. So anyway, so here I would like to demonstrate that I can pick actually the images. So I'm going to stop scanning and I'm going to pick the images and review what I have seen and what I have saved so far. For that reason, I will go to the very top here. There you go. And I will see what images were saved by the system for documentation of this exam. So in here, I can show you as well that, okay, all right. that was the image of the baby's spine, and at the same time I activated the option of the quality check, and I can say I can see here that the system recognized that this is the baby's spine, and it has some criteria for appropriate I think that here, right. Yeah, so for the appropriate regions of the spine, but also what we can see that the cervical spine was not recognized by the AI tool. So that's why it's not highlighted as seen on this image. So that's why, if you look at the color that presented here, so it's yellow, that means that the spine is seen, but it's incomplete visualization, and I need to achieve a better view in a different region. So if we move to the kidneys, so that's the image of the kidneys that was saved by the system. And as you can see, both kidneys are visible. It's labeled as the kidneys, and all the criteria are met. And this image is axial and demonstrating that anatomical region. So I can confirm that I like that image and send it to the system, to the PAC system. So this is my femur measurement, so it also the system like that. And if you will go all the way down, this is the abdominal circumference. Again, all the criteria were met, and you can see all those criteria here, and you can scroll so that this is what the system analyzes and gives you an advice. And I think that this is an amazing tool to teach our younger generation, like residents and the fellows, that they are just starting scanning before coming to you and showing what they have done. They can interact with the system and see if they really did a good job and avoid the negative feedback from you as an attending. And usually it's very painful for them, so that they can actually look good, always good in front of you, because the system tells them what they did wrong or what they didn't, or what they did good. So again, the humerus, here we can see the measurements of the head and the criteria, so that it didn't recognize the telomine. So again, it's not perfect, but this is, for the most part, this is what we were able to see. It recognizes telomine here, and this is the perfect plane, transthalamic, that is used to estimate, to measure the BPD and the head circumference. And then we actually have a little bit partial orbits, but lips and nose are perfect, and the system confirms that. So that all that I can, let's go to the heart, so that it's labeled all the anatomical structures. There's a perfect 4-chamber view. It even details that it's a 4-chamber view obtained in systole, and this is another one in diastole, and then we have another 4-chamber view here, and finally the LVUT and the 3-vessel and trachea view, which meet all the criteria, and then the aortic arch is the same thing. So that I would like to confirm all my pictures just for the sake of this demo, because you can decide, well, I want them all or I don't really. And now I'm going to finish the exam, and that, so I'm going to go to the report, and then I'm going to transfer my numbers, and then I'm going to finish the exam. And here you will be reminded that this is a second trimester template, and that at this point you haven't completed 19 components in order to comply with the guidelines that we have. So, and the system suggests that you go back, or you can go along and finish the exam, but it's definitely incomplete, and that you were not able to complete 19 items. So with all that, we can actually switch gears and show that the capability of the Sonio. This is the product that's specifically designed to help with the reporting of the results of your exam, and it has very unique features. I will tell you about them in a second. So here we have ability to have the standardization, which is critical for reading the exams. So that once we are going through the exam, the system puts the pictures in the specific order. And this is really great because as a reader, you will look at things systematically at the same order over and over again. And you can clearly visualize right away what is missing or what was not updated. And then we can go to the quality check. So this is like the second layer of the reassurance of the quality. And again, there is some redundancy here that you can use it on the system or you can use it on the computer, like if you utilize Sonio, and one can be more appropriate for sonographers and the other one for the reading physician. So because they sit in front of the screen and reading. So, but all together we can reassure that this is the sufficient quality, that structures that need to be visualized, or they are suboptimal and need to be reassessed on the follow-up examination or just reported as such. So with all that, we can generate the report pretty easily. That will include the estimated fetal weight, all the necessary parameters. And again, we didn't have enough time to complete all of that, but this has the potential. And also I would like to delineate and highlight a very specific component of the Sonio that helps you to run the practice from the standpoint of the quality improvement. So this is the analytical and statistical package that can help you to kind of see how overall your office performs. So that provides you in a very visual manner what you need to improve and how actually every single sonographer or physician does its job. So, and of course it's done not to criticize people, but to make sure that you provide the appropriate support. And for example, so we're gonna switch to the package in a second. And again, be patient with us because we are trying to put it all together. Where we go. So in here, you can clearly visualize how you're actually doing. So you can see that how many scans each sonographer performs per week or per day or per specific time period. You can see what was the average time per sonographer that was spent on the specific type of the exam. And then you can actually look at the completion of each exam and see the deficiencies. For example, if one of your sonographer or multiple sonographers, they're underperforming on the visualization of the three-vessel trachea view, you can take an action and provide the specific targeted education to improve the understanding and technical skills specifically in that area. And then you can run the statistics again, let's say in a few days or months after the intervention and education was provided and see if that got improved. So this is the way how you can monitor the performance of your office and every single team member and provide appropriate support and education and maintain the high quality standards of your exams. And with this, I would like to thank Samsung and all the team who is here today, who helped me to bring this live demo to you, our patient who was kind enough to help us as well, and Sonio and Samsung. And if there are any questions from the audience, I will be happy to answer. And of course, Dr. McGee from the remote access and his help. Thank you very much.